Okay, good afternoon. I'm Matthew, one of the education practitioners, and I'm here with Nicola. I'll get her to introduce herself shortly, but we're here for primary secondary survey into unconscious patient. We're not going to need to do a recovery position today. We can talk about it, but it'll be videoed on a separate session. Learner outcomes and components, it's 15, covering various learner outcomes, and component 16, covering learner outcome 1.5a and 1.5c. Nick, you can introduce yourself, please.
Okay, Nicola Sheard on cohort 2405.
Thank you. And you're happy that you're here for primary secondary survey?
Yeah.
And off camera we discussed what constitutes as a red flag. Are you okay with that?
Yeah.
And is there any reason why we can't start this assessment now?
No.
Okay, let's do it.
Okay.
So, you're called to a 45-year-old patient who has been found unresponsive. There are no witnesses, so no one can give you a detailed medical history. So everything is as you find.
Okay. So I'm donning my PPE, I've got my gloves on ready, and I would consider apron and goggles due to blood and possible bodily fluids. We don't know what's been happening. I'm also going to consider my DORA that the scene is safe. I can't see any drug paraphernalia, broken glass, and the scene does appear to be safe around so that I can approach the patient. I'm noting his positioning and his colour, and just seeing if I can see any signs of any catastrophic hemorrhage. And I want to see if I can get any response from the patient. So I'm going to see if he's going to respond to my voice in each ear, just in case he is deaf. Hello? Hello? And just to see if he does respond to pain. Okay, which he's not doing. So I'm going to call for, he's unresponsive, I'm going to call for a paramedic backup. Okay, so control please, can I back up? We have an unconscious 45-year-old male. So I'm just going to check for the C-spine, and I'm also going to do a head chin lift. Okay, and I'm going to use the scissor technique to look into the mouth and see if we've got any obstructions there. I'm going to feel for no longer than 10 seconds for the breathing, and I'm going to check the pulse for the circulation.
Okay, so the patient is breathing.
Okay.
And they do have a pulse.
Fabulous. Okay, so now I'm going to do put in my airways, the tripod airway, to help this patient breathe. We're going to measure the OP airway. So we measure that first of all, and that is suitable. So we're going to invert, insert, rotate, locate, and we're going to insert the nasal cannulas, nasal airways, so that the beveled end is towards the septum. Gently twisting them, making sure there's no resistance. Popping them in there. And the patient does seem to be tolerating that airway. Okay, so next we're going to do some observations. I'm going to check breathing. I'm going to just check that the chest is rising and falling regularly. I also want to just check each side to check whether I can hear any bubbles or crackles. I'm going to do the pulse oximeter. Pop that on there. And I'm going to just check the limbs here first before I put the blood pressure cuff on, to see if I can see any obvious signs of bruising or fractures, any bracelets already alert. So I'm going to put the cuff on. Okay, just checking that patient is still breathing. Okay. I'm also going to do a capillary refill test, so I'm going to do that both centrally and I'm going to do it peripherally.
What would you expect it to be?
I'd expect it to be refill, coming back to the colour within about 2 seconds.
Okay. Yeah.
Right, okay, so I've done my oxygen and I'm now going to check the radial pulse. That's regular.
So the pulses are bilateral, regular. What would you like? What numbers would you like?
Well, 20 over 80, I think.
So on your pulse, let's give you 88.
Yeah,
And you on your blood pressure?
yes please.
110 over 70.
Fabulous.
What about your
I'm
oxygen
going to
saturation?
do the saturations.
Oxygen saturations, if I told you they were 91%,
Yeah, I consider using some oxygen because we want to try and get that up to 95.
Yep.
Okay. I also need to do a rest rate whilst we're just doing that, so I'm going to just do that. Make sure that that his breathing is regular.
okay, breathing is 18.
18, thank you. Right, so moving on from that, I'm going to also check patient's eyes, going from outside in. Okay, seeing that they are equal and reacting to light.
They are?
Fabulous. And at this stage, I just want to just reassess his breathing, that he is still breathing.
He is still breathing.
Fabulous. Okay. This is where I'm going to do the BM, as blood sugars, just in case there's any signs that he could be diabetic as well. Or just low blood sugars. Okay, so I'm going to do that.
There's BM coming back as 5.
There's 5. Okay. And this is where I'm also going to do his temperature.
Temperature is 36.3.
36.3.
Yep.
Right. So I'm now going to move on to exposing him further. Okay. And considering the environment around, I want to check that his core temperature is very similar to his extremities as well.
It feels a little bit warmer now.
Okay. And also just checking the scene's safe around before I move on to my secondary survey. Okay, so yeah, I'm going to reassess the breathing again. Okay, he is maintaining that airway, which is good. And I'm going to start by the head. Okay, so I'm checking for any bleeding. I'm checking for any bogging masses. I'm just going to check his eyes again. Okay, go. And also whether there's any fluid leaking from his ears, any blood, his cheeks, and whether there's any distended veins in the neck. Okay. I'm going to move down to the chest. This is where I'm just going to be a bit more thorough. Okay, and listen to the chest a little bit more. Okay. I'm just going to check the chest for the ribs, see if I can feel any breaks, any fractures, any obvious bruising, pacemakers, and any of the media alerts. I'm also going to palpate the abdomen for any rigidity, tenderness, or any resistance. That all seems okay. Again, I'm going to check the 4 long bones, okay, for any obvious things going on there. And I'm going to move down to the pelvis area. Okay, checking there's no fluid, no bleeding, no paraprisms, and moving down to the femurs, checking they feel equal and there's no obvious fractures. I'll be taking the patient's shoes off so that I can also do a pedal pulse. Okay, and again I'm just going to check the breathing. Okay, that patient is still breathing. He's still unresponsive. So I'll consider putting him in the recovery position whilst I'm waiting for the paramedic. And if there's time to, I could perhaps listen to his back as well, just to see if there's anything going on there.
Okay, so the paramedic arrives. Could you give me an SPAR, please?
Okay. So we've got a 45-year-old male. We have no witnesses, no idea what's happened. Came in and found him from the poo and he's unconscious. So we have no background at all. I've got all his observations here. 36.3 temp. We have given him a bit of oxygen because his SATs were 91. But everything, all his other observations appear to be okay. His blood pressure is 120/70. I would recommend he gets an ECG in the ambulance on the way to the hospital, and we'll do a pre-alert as well.
Okay. So where are you going to write all this down? Where do you document all this stuff?
On the patient record, EPRF,
And why is that important?
to document everything so that we get all the observations correct, and also when we're reassessing to see where things have changed. If we've given any oxygen, it's important we convey that to the hospital, so they know exactly what's gone on from beginning to handing over at the hospital,
Okay.
and also to the paramedic that arrives on scene.
Okay, good. You just mentioned observations. Why is it important to you that you take more than one set of observations? What does it tell you?
Whether it's improving, getting any worse.
Good. Okay, thank you. What do you know about the 6 C's of professionalism?
That they all contribute to the care of the patient.
Can you remember any of them?
Compassion, I know compassion, care, and I actually can't remember at this time.
All right. You're aware of them?
Yeah,
Yeah. You know how they affect what we do in terms of how we treat patients? And
Yeah.
things, yeah. Okay.
Caldor, is that one? I don't know if that's part of that. Sorry, I actually can't remember.
Don't worry. Right, I'd like to ask you a few questions, if that's okay. So let's go back to... First thing I want to address on the video, is I've witnessed you do this assessment before, and we've spoken through it before as well. For this particular assessment, what you did is you momentarily opened the airway before you checked in it. Okay.
Okay.
But I know that you know that that's not the correct thing to do. So normally you would do what?
Check the C-spine.
Check the C-spine, then?
You would use a scissor approach to check inside the patient's mouth.
Yep, and then?
You do the head tilt gently.
And why is that important that we do it in that sequence?
So that we don't damage the neck or the C-spine and start moving the head before we know what's going on. And also, if you start moving and there's an obstruction, it could be going further down.
Good, okay. I have seen you do it the correct way before, so I'm happy that that discussion can overcome that. Alright, good. Okay, next bit, couple of questions. So, circulation assessment. When you talked about catastrophic hemorrhage, you talked about any signs of hidden blood loss, because you told me that you were kind of looking for bruising, rigidity, gardening, anything like that. What can we look at that might suggest or might help us to understand if there's any bleeding? Is there anything that we would look at globally and say?
Any cuts, any obvious trauma, the cyanosis of the patient helps look at consider the circulation.
Okay. What? How best to say it? We're going to look for some blood. Where will the blood be?
It could be coming from the openings, usually of the body, or all around the body, like going under the head here. Could have been at the back of the head where we can't see.
What do we call that? Do you remember? Blood on the floor.
Forearm.
Forearm.
Yeah.
Good. Okay. So we're looking at that. Why is it called for?
Because of the 4 long bones, checking those.
Yeah. Long bones, abdomen, pelvis.
Pelvis.
Yeah. Good. Okay. We've established this patient is unresponsive. Is there another way of checking responsiveness and unconsciousness? There's a scale that we might use. 3-letter acronym?
Not the AFPO score.
Place in Scotland? It's a scale.
Yeah.
Has numbers in it, and we'll come up with a number to determine how unconscious the patient is.
Oh, sorry, GCS.
GCS. Okay.
Yeah, the Glasgow.
Glasgow Coma Scale. And what GCS do you think this patient is?
3.
I know you've not gone into too much detail with GCS, which is why I'm happy to talk about it. But do you know why it's a 3 and not a 0? Just as a matter of interest.
I think that the minimum I've ever seen is a 3.
Yeah.
Because that is literally really not in a good way.
Yeah.
You'd be expecting more of a 15 if they are.
Yeah. So 15 is somebody who is like me and you,
Yeah.
walking and talking. 3 is the lowest you can get, even for somebody who's dead. Okay, good. Right. Let's go back to the secondary survey now. So we're just going to think about the head. We've come to the head. You've said you feel for boggy masses.
Yeah.
You're checking underneath. You're looking at your gloves for blood. You mentioned the airway. You checked the airway quite a few times, which is really good. But when we're having a listen, especially at this detailed stage, what we're listening for, what could be coming out of the airway?
There could be fluid, there could be silence even, or blood.
Okay, what about noises? What noises?
Noises, we could have wheezing, or we're listening to see if we've got signs of them coming round at all. But we all particularly want to know as well if there's any bubbling or crackling, anything unusual.
Okay, good. Just generically, if you heard funny noise, what would you do? What would you think? So let's say wheezing. What might be happening?
There could be something, an obstruction, or it could have a medical condition.
Yeah, good. Okay. Right. So we checked airway, checked head. You mentioned forehead as well. Is there any other places you would check?
The cheeks, here and around the jaw.
Okay. And what are you checking?
Whether there's any fractures, any bruising, that it's even.
You got any questions for me?
No, I don't think so.
Are you happy with those conversations we've had? Yeah?
Yeah.
All right. Okay. I'm happy to bring that to a close then.